So good evening once again. We are going to commence the quiz between the two centers, the Abuja group and the Kanu group. And the format for the quiz is going to be 30 seconds for each group. Yes, you have 30 seconds to answer your question. Now, each question carries 2 marks. If you miss a question, the other group will answer. And if they answer correctly, they will get a bonus of 1 mark. If they fail, they will not be penalized for missing because it's not their question. Then we will now ask them their own question. So each question carries 2 marks. And as I mentioned, each question will last for 30 seconds. If you miss a question, it will be a bonus for the other group. And once they get that, they will get an additional 1 mark. So we are going to commence. But before we commence, any clarification, any question? And secondly, I don't want interference from members that are not participating. Thirdly, we don't want multiple answers. You have to decide your answer. When you decide your answer, that is all. Okay, once you decide that this is the choice of your answer, you cannot, you can't be answering multiple questions. You have to decide within 30 seconds to answer your question. Okay, if you fail to do that, you will lose that question. So any clarification, if you have any clarification, you should ask before I commence with the first question. Because if I start, there will be no room for asking so many questions.
So I have a
question. Yes.
Or any member from either of the centers can participate and give an answer on behalf of the group. It doesn't have to be the representatives.
No.
Right.
Okay. It's only the 2 representatives because I can't determine who is a member of this group and that group within 30 seconds. It was going to be so rowdy. So
okay, so
representatives of these 2 groups, because if everybody is answering, it's no longer a quiz. Okay.
So Amos' network is bad, so I don't know if someone can fill in for him.
That is an arrangement that you guys should have made to get a backup in case, but you spend like 30 minutes before joining. And now his network is bad. So you see something that I cannot help at this moment. I don't know, even all the Abuja group, none is refusing to acknowledge his or her presence on the program. So you see, that is, what will you do? Okay. Is Amos ready? Okay, we'll just start. Let me start with the first question. After reading the question, your time will start reading. Okay. So the first question will go to the Kanu group. Contact tracing. A is important in controlling all infectious diseases. B involves contact listing and contact finding. C, contact follow-up refers to clinic follow-up for improvement in symptoms. D, all of the above. Your time starts. You have 30 seconds. You have only, you make one option. Choose one option.
Sir, the answer is D.
The answer is D, correct. Kanu group has 2 marks. Okay, so I'll move to Abuja group. D says contact follow-up refers to clinic follow-up. No, D is all of the above. So all these options regarding contact tracings are correct. So let's move to Abuja group. Sources of demographic data include A, census, B, registration of vital events, C, demographic survey, D, all of the above. Your time.
D, all of the above.
All of the above, correct. Okay, so sources of demographic data, you can get that through population census, registration of vital events, demographic survey. So all of the above is correct. Okay, so Abuja group got 2 marks. So Kanu group, as per WHO, low birth weight is defined as birth weight less than 2.5 kg, birth weight less than 10th percentile, gestational age less than 34 weeks, gestational age less than 28 weeks.
A.
The answer is A.
The answer is A.
A.
Correct. So Kanu group got 2 points. Okay, so as per WHO, low birth weight is defined as birth weight less than 2.5 kg. Okay. So next, we'll now move to Abuja group. Question 4, maternal mortality rate is calculated by maternal deaths per live birth, maternal deaths per 1,000 live births, maternal death per 100,000 live births, maternal deaths per 100,000 population.
C, maternal death per 100,000 live births.
Maternal death per 100,000 live births. That is correct. You have 2 points. So an estimation of maternal mortality, don't forget, is deaths per 100,000 live births. Okay, so Kanu group, your question. Among the following, the best indicator of health in the community is A, maternal mortality rate, infant mortality rate, life expectancy, neonatal mortality rates. Kanu group, your time.
C. Life
C is 0.
expectancy.
Life expectancy.
C is 0. So, and the time is up. The other group cannot get. The 30 seconds is already over. So, or I will improvise 5 seconds for next time. I will improvise 5 seconds for the other group to get a bonus. And don't forget, you answer only once. Once you mention an answer, that is all. You cannot choose another answer. So you have to be very careful in selecting. So Kano group, you got 0. The answer is B. The best indicator of health in a community is infant mortality rate. Don't forget. Okay? So Abuja group, the current recommendation for breastfeeding is that A, exclusive breastfeeding should be continued till 6 months of age, followed by supplementation with additional food. Exclusive breastfeeding should be continued till 4 months of age, followed by supplementation of additional food. Colostrum is the most suitable food for a newborn baby, but it is best avoided in first 2 days. The baby should be allowed to breastfeed till 1 year of age. The current recommendation, your time?
A.
A, correct, 2 points. So Kano group. Now, this is exclusive breastfeeding for 6 months, which is followed by supplementation. From that 6 months, you know, the requirements cannot be provided by the breast milk alone, like what do you call it, iron and other micronutrients. So you have to supplement with other forms of feeding. Okay, Kano group. The milestone of development not matched correctly with age. A, sit without support, 6 to 8 months. Look at mother and smile, 6 to 8 weeks. Hold head erect, 6 months. Transfers object hand to hand, 6 to 8 months. Can you group your time? Not matched correctly.
C.
C.
C, correct. Oh, did you mention 2 answers?
No, sir.
No, just one. C.
So if you mention 2 answers, it's 0. So C is correct. Okay. So next we'll move to Abuja group. WHO growth chart has got information for all except immunization procedure, child spacing, history of sibling health, history of maternal health. Your time?
C.
C, 0. Kano group bonus for you.
B.
0. So no bonus. So the answer here is D, history of maternal health. WHO growth chart does not have information on maternal health. So the answer is D. So back to Kano group. The commonest morbidity in school in schools is A, dental ailments, B, worm infestation, C, malnutrition, D, skin diseases, the commonest morbidities in schools. Yes, your time?
Worm infestations.
0. Kano, Abuja,
A, dental ailments.
bonus for you. The commonest in school is dental.
Dental ailments, A.
Yes. So she got a bonus. Okay. So the bonus is for Abuja group. Then Abuja, your question. Dex for students is A, minus dex, B, plus dex, C, 0 desk, D, all of the above.
Plus desk.
0. Bonus. Kanu, bonus.
C. 0. 0 deaths. I have no idea.
0. So the answer here is A. No bonus for Kanu group, and Abuja group got 0. The answer is minus desk. Now, don't forget, the essence of quiz is for you to go back and review all these topics. Okay. Now, let's move to Kano group. Kano group. The following are examples of infections transmitted through fecal-oral route, except A, hookworm, B, cholera, C, guinea worm, D, soil-transmitted helminths.
Guinea worm.
What is that? Is C?
Yes, sir.
False. 0.
Wow.
Bonus for Abuja group.
D.
D, correct. Soil transmitted helminths. You got +1 there. Okay. Abuja group. Helsinki Declaration. Helsinki Declaration, A, developed by Nigerian Medical Association 1964, is a statement of ethical principle. Is guided by 4 principles of ethics, consists of 30 set of regulations and guidelines. Abuja group.
A.
0. Bonus for Kado group.
B.
B.
B,
Is
correct.
a statement of ethical principle.
So you have 1 bonus for that. So now let's move to Kano group. Your question. In HIV-associated tuberculosis cases, treatment with antiretroviral should begin A, before anti-tuberculosis drugs are started, after tuberculosis drugs are started, concurrently with antiretroviral drugs, D, after intensive phase of anti-tuberculosis drug. Your time?
Concurrently with antiretroviral drugs.
That is what? Be calling the figures.
C.
C, correct. 2 points. Let's move to Abuja group. Regarding transmission of Zika virus, A, can be transmitted via the placenta. B, salviatic transmission involves dogs. Sexual transmission is possible only within 6 weeks of infection. All of the above. Abuja group.
A can be transmitted via the placenta.
Correct. 2 points. Okay. I saw a lot of messages. Okay. So let's move to Kano group. AIDS Day is on 7th May, 1st December, 20th November, none of the above.
First of December.
1st of
B.
December, 2 points. Okay. So, Abuja group. Monday fever is associated with A, bagasosis, B, bicyanosis, C, asbestosis, D, silicosis.
B, carcinosis.
Correct. 2 points. Yes. Kano group, your turn. Which of the following are associated with bladder cancer? Nickel, naphthalene, naphthylamine, arsenic, lead. Kano group.
D,
Kano
lead.
group. Lead, 0. Bonus.
B.
B, correct. Naphthylamine. +1. Yes, Abuja group. According to biomedical waste, which of the following bag can be incinerated? A, red, B, blue, C, green, D, yellow.
Yellow, D.
D, correct. 2 points. Kano group. Regarding Anopheles mosquito, true is all except A. Eggs are laid singly on water. Larvae don't have siphon tube. Wings are spotted. Pupa don't have siphon tube.
D, pupa doesn't have siphon tube.
Correct. 2 points. Abuja group. Which of the following is a nuisance mosquito? Anopheles, Culex, Aedes, Mansonoides. Nuisance mosquito.
D.
D, 0. Bonus.
Anopheles?
No, 0. The answer is Culex mosquito. So 0 for Abuja group, no bonus. for Kanu Group. So we are through with section A. Let's see how many questions were answered. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So we'll give, so Kanu Abuja Center answered, there are 20 questions. They are supposed to be 10. How come? Was a question skipped?
They all answered 10.
It's 10. So let's count and see how much they scored in both sections.
Abuja is leading.
So Abuja scored how many? 12 plus 3 bonuses. 15. Section A, first section, 15 points. They scored 1, 2, 4, 6, 8, 10, 12 with 3 bonuses. 15. Then Kanu, 2, 4, 6, 8, 10, 12 plus 1 bonus, 14. So for the first section, Abuja is leading with 1 point. So we'll move to section 2 now.
So they are leading with 2 points. It's 13-15.
13.
Kano Group 13. Abuja
13.
15.
Okay. 13. So Abuja is leading with 2 points. Where is the other partner for Abuja Group now? He abandoned. Where is Amos?
No, sir, I'm here, sir.
But you have not been speaking now. You see, you just kept quiet. Okay, let's go to the second section. You are ready? You are all ready?
Yes, sir.
Yes, sir.
Okay. Kanu Group. During a snowstorm, a 52-year-old man is brought to the emergency department after multiple car accidents. Which of the following condition is produced by a force that drives the trunk forward while the head lags behind in a rear-end automobile collision? A, scoliosis. B, hangman fracture. C, meningomyelocele. D, whiplash injury. E, herniated.
Whiplash injury.
Whiplash injury.
So be calling the letters rather than. So D, 2
Yes, sir.
points.
D.
Okay. Abuja Group, a 2-year-old boy presents with pain in his groin that has been increasing in nature over the past few weeks. He is found to have degenerative malformation of the transversalis fascia during development. Which of the following structures on the anterior abdominal wall is likely defective? A, superficial inguinal ring, deep inguinal ring, inguinal ligament, sac of a direct inguinal hernia, anterior wall of the inguinal canal. Abuja Group.
Deep inguinal ring.
Deep inguinal ring. 2 points. B. We calling the letters. Correct. 2 points. Abuja Group. Don't forget you are 2 points behind. The Kanu Group. All the following bonds require extra fluid administration except bonds greater than 70%, electric bonds, inhalational bonds, pediatric bond, 4th-degree bonds.
Inhalational injury.
Yes?
So I said inhalational. C.
Wrong. 0. Bonus for Abuja?
E,
I can't hear you.
E, 4th degree burn.
So time over, no bonus for you. So let's go to Kano group. Let's go to Abuja group, sorry. 33-year-old man is involved in a house fire and sustained 2nd and 3rd degree burns in his face, anterior chest, trunk, entire left arm, perineum, and both legs circumferentially. What is the estimated total body surface area involved? Abuja group. Abuja group.
A, 68.
Correct, 2 points. Kano group. During wound healing, collagen is laid down by A, endothelial cell, fibroblasts, wandering macrophage, surrounding epithelium, none of the above.
B.
B, correct, 2 points. Abuja group, all of the following are complications of breast implant except A, capsular contraction, increased risk of infection, breast asymmetry, systemic inflammatory reaction. Abuja group.
D, systemic inflammatory reaction.
Correct. Kano group, digital rectal examination in surgical outpatient clinic can be done with the patient in the following position. A, lithotomy lateral, A and B are true, seems all of the above are true. Yes?
Let's C.
Yes?
C.
C,
C, sir.
wrong.
A and B are true.
Bonus?
E.
Wrong. The answer
Sir,
is,
did you say C is wrong?
A.
the answer is D.
Same position. Wow.
That is left lateral position. Sims position is left lateral position. So the next question will be for Abuja, but because of the timer, we'll just take 1 minute so that I readjust the slide so that it stop going shorter than the allotted time. Okay. Yes, the next question will be for Abuja group. "28. Which of the following is not a classical finding in someone with raised intracranial pressure? A, headache with nausea and vomiting. B, respiratory changes. C, increased blood pressure. D, tachycardia." Your time.
B, respiratory changes.
0. Bonus for Kanu group.
D.
What is
D.
that?
D. Tachycardia.
Tachycardia.
+1, correct. So let's move to Kanu group. What is the most common cause of epidural hematoma? A, ruptured middle cerebral artery. B, ruptured anterior cerebral artery. C, ruptured posterior communicating artery. D, ruptured middle meningeal artery.
D.
Yes, your time is going.
D, sir.
D, sir.
Ruptured middle meningeal artery. D.
So correct, 2 points. Abuja group. What is the typical appearance of an acute subdural hematoma on non-contrast CT? A, diffuse intraparenchymal hypodense mass, hyperdense biconvex mass, hypodense intraventricular mass, hyperdense concave mass. Abuja group.
Hyperdense concave mass. D.
Correct, 2 points. Kanu group. Eversion of the lower eyelid margins is termed A, trichiasis, B, entropion, C, ectropion, D, chalazion.
Ectropion.
D.
Ectropion.
C, sir.
Ectropion. C.
Yes, sir.
2 points. Abuja group. The following conditions, which is not considered a urological emergency. A, paraphimosis. B, priapism. C, orchitis. D, testicular torsion. E, autonomic dysreflexia. Abuja group.
C, orchitis.
Orchitis. 2 points, correct. Kanu group. About hernias. Which of the options is correct? Litters hernia is a hernia with appendix as a component. B, incisional hernias are congenital ventral hernias. C, a pantaloons hernia has both direct and indirect components. D, all of the above. Kanu group.
Sir, C, pantaloon hernia.
Correct. 2 points. Abuja group. The tetrad of features found in infantile intussusception include the following, except A, sausage-shaped abdominal mass, paroxysmal attack of colicky abdominal pain, passage of bloody mucoid stool. All of the above are correct.
D, all of the above are correct.
2 points. Kanu group. About the prostate gland in a Nigerian. It is unlikely to ever develop cancer compared to Caucasian. Benign hyperplasia occurs as early as 18 years. It is multinodular. D, none of the above. Kano group?
Sir, D. None of the above.
Correct, 2 points. Okay, Abuja group. About the classification of chest injury. Flail chest is an example of life-threatening chest injury. B, hemopericardium requires a thoracotomy. Tension pneumothorax can be life-threatening. Open pneumothorax can cause an immediate life to life. Abuja group.
B.
B, correct. 2 points. Okay, Kano group now. A 25-year-old man was brought to the accident and emergency department with sudden severe generalized abdominal pain. Physical examination shows pulse rate of 120 beats per minute, blood pressure 90/60 millimeters of mercury, and board-like rigidity of the abdomen, which is false. A, if due to acute pancreatitis, urgent surgical intervention is the treatment of choice. B, may be due to perforated duodenal ulcer. C, acute pancreatitis is a likely cause. D, he will require an erect chest upper abdominal X-ray, which may show air under the diaphragm. Kano group.
A.
A, 2 points. A is false. All others are correct. Abuja group, regarding typhoid perforation, it frequently affects neonates. Gas above the diaphragm may be present on plain erect chest radiograph. The causative organism, Salmonella typhi, is acquired by hematogenous route. The perforation is the result of invasion, necrosis, and ulceration of the Peyer's patches. Abuja group.
D.
D, 2 points. Kano group. Surgical causes of hypokalemia include the following, except A, biliary fistula, B, typhoid perforation, infantile hypertrophic pyloric stenosis, renal failure due to bladder outlet obstruction, all of the above. Kano group.
D, sir. Renal failure due to bladder outlet obstruction.
2 points. Abuja group, I think. Okay. Gastric outlet obstruction produces the following metabolic derangement, except A, hypokalemia, B, metabolic alkalosis, C, hyponatremia, D, hyperchloremia, E, paradoxical aciduria in the later phase. Abuja group.
D, hyperchloremia.
Correct, 2 points. So we've come to the end of the second section. We'll move to section 3, but let's see the total score. Dr. Mariam, are you with us? What is its total
Yes,
score?
sir.
Kano Group.
Abuja is still leading.
Okay. What
Kano
is the
missed
total score?
2 questions in the second session.
Okay, we have 2, 4, 6, 8, 10, 12, 14, 16, plus 1 bonus 17. While Abuja got 2, 4, 6, 8, 10, 12, 14, 16, 18. 18.
Yes.
So in the first session, in section 1, Abuja is leading with 2 points. In the second section, Abuja is leading with 1 point. So we have 2 more sections to go. If you can bail yourself out, that is fine. Okay? So we are moving to picture tests. The next 2 sections will be on picture tests. Okay. Question 1 to Kano Group. Anterior and posterior urethral valve is commonest cause in adults. Neurogenic bladder is a possible cause. Patient is likely to have recurrent UTI. Examination of the external urethra may disclose phimosis or meatal stenosis.
B, sir. Neurogenic bladder is a possible cause.
0. Bonus for Abuja Group. Okay, 0-2. So this question is showing a patient with suprapubic distension. Okay.
Yau ki tafi da jakar kito.
Your answer
Mun cika jakar.
answer, you are to choose the single best option. And this single best option may be the only correct one, or it may be the only odd one. So you can see A says anterior and posterior urethral valves is the commonest cause in adults, which you see it's false. And anterior and posterior urethral valves are things you see in pediatric age group, okay? So that is the only odd one out. So let's move on to Abuja Group. Number 2, which of the following is false? It is a reversible condition. Propranolol is an important component of its management. The image demonstrates enophthalmos, which is a characteristic feature. An ECG should be done to detect arrhythmias. None of the above. Abuja Group. Abuja Group.
Answer is A. It is a reversible condition.
0. Which is false?
C.
So this is C. C.
Okay, you have a bonus. Okay, let's go to Kano Group. Which of the following is not a likely finding in the above condition? A, breast lump, pudendrange, nipple retraction, nipple discharge, cervical lymphadenopathy. Kano Group.
Cervical lymphadenopathy.
2 points. Abuja Group, describe the displayed image. A, biconvex hyperdense lesion, dilated ventricles, crescenteric hypodense lesion, concave hyperdense lesion with midline shift. Abuja Group.
D.
D, correct, 2 points. Kano Group, what is the likely diagnosis? A, hydrocephalus. B, chronic subdural hematoma. C, acute subdural hematoma. D, acute epidural hematoma. E, subarachnoid hemorrhage.
Subdural hematoma. C.
Correct, 2 points. Abuja Group, A, it's an artificial fistula. B, colostomy hernia is an immediate complication. Necrosis of the stoma can cause colostomy breakdown. Colon cancer is an indication. Abuja Group.
D.
Okay, it's 0. And no time for bonus is gone because this is a colostomy now. Okay, it's an artificial colocutaneous fistula for the purpose of diversion of feces and flatus. That is the aim. Now, B says colostomy hernia is an immediate complication. It is false. That is a late complication. A is correct, B is false. Necrosis of the stomach can cause colostomy breakdown. It's true, it's a complication. Colon cancer is an indication. So the odd one here is B. Okay. Kano Group. What is this instrument used for? A, removal of wax, protecting tissues during surgery. IUCD insertion, grasping tissue during surgery.
D, grasping tissues during surgery.
2 points. Abuja Group, which of the following is false regarding the diagnosis? A, craniotomy is considered life-saving. The commonest site of bleeding is the middle meningeal artery. Treatment should be delayed. Commonly involve the temporal and parietal lobes. Abuja Group.
C. Treatment should be delayed.
2 points. Kano Group, which is the likely diagnosis? A, chronic subdural hematoma, acute subdural hematoma, extradural hematoma, intracranial hemorrhage, subarachnoid hemorrhage.
Extradural hematoma. C.
2 points. Abuja Group, the commonest complaint is headache and sweating. Growth hormone secreting tumor is a possible cause. Carpal tunnel syndrome is not a likely complication. Characteristic spade-like hand and feet. Yes? Abuja Group.
B.
B, growth hormone secretory tumor. 0. Bonus.
C, sir.
C,
C.
correct. +1. Where is the partner for Abuja Group? Amos, are you with us? Where is Amos? Okay. Kano Group, a 50-year-old presented with complaint of abdominal pain, distension, and constipation. Which of the following is false? Valvulae conjunctis can be seen. There are visible dilated loops of intestine. It is classical double bubble appearance. Diagnosis is that of small bowel obstruction. All of the above.
C.
C, 2 points. So it's the only false option here. Abuja Group, identify umbilical cord clamp, IUCD, Volcelon, none of the above. Abuja Group,
None of the above. D.
2 points. Kano Group, which of the following is not a likely cause? Iodine deficiency, exposure to radiation, autoimmune malignancy, none of the above. Kano Group,
None of the above.
2 points. Abuja Group, all of the following are possible complications of its use except tachypnea, pneumonia, dental injury, vocal cord accident, difficulty in breathing.
E. Difficulty in breathing.
Difficulty in breathing, 0. Bonus.
Dental injury, C.
No, the answer is tachypnea. The answer is tachypnea. All these are complications of endotracheal tube placement. Okay, of course, they can have pneumonia when you introduce infection, dental injury. If the patient have implants, you can injure the vocal cord. They could have laryngeal edema that will cause difficulty in breathing. Okay, so, okay. So let's move on. Kano Group. The display image is A, procedentia, skin tag, external hemorrhoid, rectal prolapse, none of the above.
External hemorrhoid.
2 points. Abuja Group. What is the instrument used for endotracheal intubation, NG tube feeding, in esophageal atresia, acute epiglottitis?
Endotracheal intubation. A.
2 points. Okay. Kano Group. Which of the following is not a cause of gynecomastia? Chronic liver disease, anti-cox, obesity, HIV, none of the above. Kanu Group.
HIV.
2 points. Abuja Group. The displayed deformity is as a result of injury to the A, radial nerve, median nerve, ulnar nerve, brachial nerve.
B, median nerve.
0. Bonus.
Ulnar nerve. C.
1 point. Okay. Kanu Group. You are asked to review a 72-year-old man on the orthopedic ward. He had a hemiarthroplasty of his right hip 6 days earlier. He was recovering well initially, but has now developed significant abdominal distension. He has not opened his bowels or pars flatus for the last 4 days. Which of the following is not part of conservative management of this patient? A, keep MPO. B, give IV fluid. C, nasogastric decompression. D, bowel resection. E, none of the above.
D. Bowel resection.
E.
2 point. Abuja Group. It is defined as protrusion of a viscous or its parts through a defect in the wall of its containing cavity. A, risk factors include chronic cough, constipation, and surgery. B, herniorrhaphy involves hernioctomy and repair of the posterior wall defects. C, all of the above are false. D, all of the above are true.
D.
2 points. Kano Group. The insertion of the following instrument is indicated in which of the following? A, urethral stricture. B, benign prostatic hyperplasia. C, acute retention. D, bladder stone.
C.
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 Acute urinary retention.
2 points. So, Abuja Group, the instruments shown below: A, Lenz tissue faucet, Alice tissue faucets, anal dilator, artery faucets.
Alice tissue forceps. B.
2 points. Okay. Kano Group, which of the following option is incorrectly paired with regards to color and size? A, yellow, 24. B, blue, 22. C, pink, 20. D, green, 16.
Okay. Yellow 24, blue 22. D.
2 points. Kano Group, what is the correct description of the chromic catgut suture shown below? A, synthetic non-absorbable. B, synthetic absorbable. C, natural absorbable monofilament. D, natural absorbable multifilament.
A.
Abuja Group.
Synthetic non-ab.
Abuja Group. Is it Abuja Group that is answering?
Yes, sir, it's Abuja Group.
Yes.
C.
C, correct, 2 points. Kano group, you have to, if you interfere again, I'll deduct 1 mark from your points. What is the correct description of the nylon suture shown below? A, synthetic non-absorbable, synthetic absorbable, natural absorbable monofilament, natural absorbable multifilament.
Synthetic non-absorbable.
Synthetic non-absorbable, 2 points. A is correct. Okay, Abuja group, identify the instrument shown below. Kelly's retractor, Doyne's bladder retractor, Morris retractor, Hook retractor. Abuja group.
B, Doyne's bladder retractor.
2 points. Kano group, which of the following statement is true regarding the picture below? Used as maintenance fluid in adults, used for surgical skin preparation, colloid infusion, hypertonic, use as plasma expander, all of the above. Kano group.
C.
C.
Colloid infusion.
C, colloid infusion, hypertonic use of plasma expander, 2 points. Abuja group, which of the following statements is true regarding complications of the instruments in the picture below? A, injury to the nasopharynx, false passage into the trachea, esophageal perforation with fistula formation, all of the above. Abuja group.
D.
D, 2 points. Kano group. What is the most appropriate differential diagnosis of painless scrotal swelling in a 2-year-old boy? A, hydrocele. B, lipoma. C, prostate cancer. D, all of the above.
A.
A, hydrocele.
Hydrocele.
2 points. Abuja group. Identify the features seen on the chest radiograph shown below. A, hilar lymphadenopathy. B, cannonball metastasis. C, air fluid level. D, mediastinal shift.
B, cannonball metastasis.
2 points. So we've come, okay, we still have some. Kano group, identify the instrument. B, mention 2 procedures used for. So you have 30 seconds to identify and mention 2 procedures.
It's a Jones thyroid retractor.
Yes. B part, mention 2 procedures it's used for.
It is used in thyroid surgeries and vaginal surgeries.
And what?
Vaginal surgeries.
0, so you got 1 mark. You have to get the 2 procedures to get the other mark. So it is used for thyroid surgeries. Because it's time, she won't answer the bonus. And parathyroid surgeries. It's used for thyroid and parathyroid surgeries. So Abuja group, what does the picture depict? What investigation modality is this? You have 30 seconds.
Sir, it's a barium enema showing a filling defect. So
you got 0 because this is a barium meal. Enema is injected, it's instilled through the rectum. Okay, for large bowel. This is the stomach, and it's depicting, this arrow is showing you a gastric outlet obstruction. So it's not barium enema, it's barium meal. And because it has outlined the intestine, you call it barium meal and follow through. So it depicts gastric outlet obstruction, and it is a barium meal and follow through. So you got 0 there. Kano group. Mention the boundaries of a safe triangle in which the instrument can be safely passed. You have 30 seconds.
It's a chest thoracostomy tube.
0. You have both. Oh, the time is up.
Triangle of safety, sir.
No, I said it's the boundaries we are asking. Look at the question. It says boundaries of the safe triangle. Okay. So you got 0 there. Abuja group, mention the lethal 6 of the deadly dozen. The lethal 6 of the deadly dozen.
area obstruction,
Airway obstruction,
cardiac tamponade,
cardiac tamponade,
tension pneumothorax,
tension pneumothorax,
open pneumothorax,
open pneumothorax,
massive hemothorax,
massive pneumothorax.
and flail
The
chest.
time is up.
Flail chest.
So you did not mention the 6 before your time. So you got 1 mark there with flail chests. Kano group, what is the modality of evaluation of this condition called? What are the components of the modality? You have 30 seconds.
It's called the triple assessment, and it contains physical examination and history taking, cytological or histological essay, and radiological essay.
Okay.
Sorry, radiological investigations.
So 2 points. It is called triple assessment. And these 3 are clinical, which is history and examination, radiological, which is mammography or ultrasound, and pathological, which is FNAC or true cut biopsy or histology, or biopsy for histology. So 2 points. Abuja group, what does this picture depict? Mention 3 abnormalities. What is the immediate intervention?
It's showing a right-sided tension pneumothorax. We can see the shift of the trachea to the contralateral side, depression of the diaphragm, of the ipsilateral diaphragm, and then we can see loss of long markings on the right side. And then the treatment is needle thoracostomy.
Needle thoracostomy where?
And the second intercostal mid-clavicular.
2 points. Okay, then Kano group, what does this picture depict? Mention 2 abnormalities. What are the cardinal features? 30 seconds. 30 seconds. You have 9 seconds left.
It shows stepladder sign, seen in small bowel obstruction and
0.
gastric outlet obstruction.
0. Your time is up. This is an image. It depicts intestinal obstruction. That is just what the picture is. A plain abdominal X-ray that is depicting intestinal obstruction. You have air fluid levels here, multiple air fluid levels. And you can see volvulae conjunctivis, this transverse radio-opaque marking on the small bowel. What are the cardinal features of intestinal obstruction? Colicky abdominal pain, constipation, distension, and vomiting. So you got 0 there. Abuja Group, mention 4 indications for treatment. Mention 3 diagnostic investigations in the management. Yes, Abuja Group.
Indications for treatment. In case of if there's difficulty swallowing, severe symptoms, if the person is having severe symptoms,
You got 0. You see, the commonest indication for treating goiter, anterior neck swelling, is for cosmetic reason, cosmesis. Then followed by symptoms of toxicity, hyperthyroidism, when they have symptoms of toxicity. Then when they have pressure symptoms, and when they have features of malignancy. These are the 4 main indications for treatment. And the diagnostic investigation, once you do thyroid function test, it's a diagnostic indication. If it is toxic, it will show you diagnostic feature. If you do ultrasound, it will tell you the origin, where it's coming from. It's originating from the thyroid gland. And when you do a fine needle aspiration cytology, it will tell you whether it's benign or malignant. So you got 0 there. Kano Group, mention 5 uses of this instrument. Five uses of this instrument. Kano Group, are you there?
Yes, sir. For therapeutic indication, for relieving acute urinary retention, for monitoring urine output in burns and shock.
So you got
For
1.
diagnosis, stricture and BPH. Differentiate between stricture and BPH.
Your time is over. Okay. 1, you can use it for monitoring urine output. 2, you can use it to relieve acute urine retention. 3, you can use it for some investigative measures like IVU, RUG, okay? 4, you can use it as, you can improvise it as a drain. 5, you can use it to secure hemostasis. When you are doing myomectomy or when a patient has epistaxis, you can insert it around a gauze soaked with adrenaline and inflate the balloon. These are some uses of urethral catheter. Okay, Abuja Group, identify, mention 3 uses. Abuja Group, identify.
It's a surgical suture material, surgical suture needle, and then uses is for simple sutures, to close simple sutures. You can use it to bring to close open wounds. You can also uses for simple suturing, continuous, and then horizontal.
Your time is up. This is a suture, suture material. You got 1 point there. They said mention 3 uses. Now, sutures are used for approximation of wound edges. 2, you can use it for ligation of blood vessels. 3, you can use it to anchor drains. Okay? So you got 1 point there. So we are done with section 3. So we are going to calculate the marks in section 3. Are you with us, Dr. Mariam?
Yes, I'm with you, but I missed one question in the Kano session.
Let me start with Kano group. 2, 4, 6, 8, 10, 12, 14, 16, 18, 20, 22, 24, 26, 28, 30. Then they got 31, 32. Then 3 bonuses, 33, 34, 35. They scored a total of 35 points in section 3. Then Abuja group, 2, 4, 6, 8, 10, 12, 14, 16, 18, 20, 22, 23, 24. They scored 24 points from section 3. So Abuja, the Kano group is leading with 11 points in section 3. So we are going to move to the last section now, which is section 4. Amos, are you back? You have abandoned your partner. All the Abuja group have abandoned their person. Okay. So let's move to the last section. Okay. And we have 10 questions in this last session. Abuja group, if you can get all your scores and get their bonuses, otherwise, that is the only way you can beat, because you are already leading in the first 2 sections. The only way you can escape is not to fail any question. Okay, let's start with Kano group. Question 1. Which of the following is an autoantibodies in the most, which of the following is autoantibodies is the most specific? A, anti-nuclear antibody. B, anti-Rho. D, anti-DS DNA antibody. D, anti-Smith. E, none of the above. Kano group.
C, sir. Anti-DS DNA.
0. Bonus.
D, anti-Smith.
Anti-Smith, correct. +1. Okay, so Abuja group, which of the following is not a cause of this condition? A, bronchiectasis. B, ulcerative colitis. Infective endocarditis. Bronchogenic carcinoma, none of the above. Abuja group.
E, none of the above.
2 points. Kano group, identify the illustrated deformity. A, Botonius deformity. Haberdin's nodule, Boucher's nodule, swan neck deformity, dinner fork deformity.
D.
Swan neck deformity.
D.
D.
So you got 0 because you answered multiple.
No, we said D, sir.
And
We said D. Swan neck
D.
deformity.
Okay, D, 2 points. So Abuja Group, which organism is the most likely cause? Herpes simplex 1, herpes simplex 2, varicella zoster virus, Epstein-Barr virus, molluscum contagiosum. Abuja Group.
E.
I can't hear.
E, molluscum, sir.
0. Bonus.
C, varicella zoster virus.
Varicella zoster, correct. +1. Kano Group. This patient is likely to have which of the following? A, karyotype of 45XO, rudimentary ovaries, amenorrhea, web neck, all of the above.
E, all of the above.
2 points. Abuja Group. Which of the following is true regarding this condition? It is more commonly seen among adolescents and the elderly. It is commonly caused by excess vitamin D in the body. Treatment include daily vitamin D supplementation. Vitamin D deficiency is the only etiological factor.
C.
C, correct, 2 points. Kano Group. Which of the following is not a likely feature? A, mental retardation. B, short and broad neck. C, simian stress. D, hypotonia. E, low set ears.
Hypertonia, D.
D.
Correct. Abuja Group. Which of the following is not true? It can also be present with redness and swelling of the eye. The displayed image is the classical presentation. It can be familial or sporadic. It is a rare primary malignant intraocular tumor. Abuja Group, not true.
A.
A is false, 0. Bonus.
D, it is a rare primary malignant intraocular tumor.
Yes, +1. Kano Group. Which of the following is not likely to cause this? A, nephrotic syndrome. B, liver cirrhosis. C, malnutrition. D, none of the above. E, all of the above.
D, none of the
None
above.
above.
2 points. Abuja Group. All of the following are true about this condition, except it can occur as a result of maternal gonococcal infection. It is called ophthalmia nonatorum. It does not require any form of treatment. All of the above, none of the above.
C.
C, 2 points. Kano Group. Which of the following is not a feature of this condition? A, it is cystic. B, positive transmission test. C, it is attached to the skin. D, it is globular swell. It is a globular swelling. E, none of the above.
C, it is attached to the skin.
Correct, 2 points. Abuja Group, the instrument displayed
Yes.
is a couscous speculum. It can be used to visualize the anterior and posterior vagina. It is used during pap smear. It is self-retaining. Yes?
B.
B, correct. 2 points. So that is the false one.
Kano are leading us, nonsense people.
Kano,
Kano, they are leading. Quiz Mickey.
Guys,
Kano,
mute yourself.
nulliparity is a risk factor. It can present clinically as irregularities of menstrual cycle. Subfertility is not a common complication. It rarely undergo malignant transformation. Kano Group,
D, subfertility is not a common complication.
2 points. Abuja Group, risk factors include multiparity, multiple gestation, and previous uterine scar. B, patient present with history of recurrent pinless vaginal bleeds. Spontaneous vaginal delivery should be attempted in all types. McAfee regimen is a form of conservative management with the main aim of prolonging pregnancy. Abuja.
D.
What?
E.
Read it out. I can't hear you clearly. What option?
C. Spontaneous vaginal delivery should be attempted in all types.
2 points. Yes, this came out in your last exam. Kanu?
Yes.
The displayed image is that of A, of a TED stocking. B is defined as bleeding from the genital tract.
Hey, but Agama
Greater than 1,000 mils after SVD and 1,500 mils after CS. Postpartum hemorrhage is an obstetric emergency, complicating 5 to 8% of vaginal deliveries. Previous history of postpartum hemorrhage is not a risk factor for recurrence. Primary PPH occurs after 24 hours of delivery. Kano Group.
C, postpartum hemorrhage is an obstetric emergency. C.
2 points. Abuja Group. Question 16. It is an important component of management of second stage of labor. It plays an important role in prevention of PPH. It can be used for induction of labor in a woman with previous uterine scar. Delayed cord clamping is a component of active management of labor. Abuja Group.
D.
D for dog. 0.
A.
Bonus.
B.
B.
It plays an important role in the prevention of PPH. B.
Correct. 1 mark. Kano Group. Cervical incompetence is a premature pinless dilatation of the cervix in pregnancy before the onset of labor. B, indications for use of the displayed image can be prophylactic or emergency. C, the image is a Marcelin tape. D, uterine contractions are not a contraindication to performing a cervical sacrilege. Donald and Skrodka are some of the techniques that can be used. Yes?
C, the image is a Marcelin tape.
Wrong. Bonus? Bonus?
B.
What?
B?
B for boy? Okay, time up. 0 for Kanu. And no bonus for Abuja. The answer is D. Kanu group. Sorry, Abuja group. This is a classical ultrasound finding of molar gestation. A complete mole is as a result of purely maternal conceptus. A partial mole has a triploid karyotype and contains fetal tissues. Disproportionate uterine size is commonly seen on examination. Exaggerated pregnancy symptoms is part of clinical presentation. Abuja group. Abuja group, are you with us?
A.
A. 0. Bonus?
B.
B.
A complete mole is as a result.
The last question goes to Kano group. Mechanism of action include local inflammation, inflammatory reaction, uterine malformation is a contraindication to its insertion. It can increase the risk of ectopic pregnancy. It can be inserted with an ongoing PID. Uterine perforation is a possible complication.
D. It can be inserted with an ongoing PID.
Okay, that is the negative one, 2 points. So we've come to the end of the last section of this quiz, where Kanu group got a total of 2, 4, 6, 8, 10, 12, 14, 16, and they have 4 bonuses. 1, 2, 3, 4. They have a total of 20 points. Okay. Then
competition
let's see Abuja group 2, 4, 6, 8, 10. Okay, plus 1 bonus, making 11, total of 11 points. So yes, we've come to the end of this quiz. For the first section, section 1, Kanu group got 13 points, and Abuja group got 15 points. Abuja was leading with 2 points in section 1. Then section 2, Kano got 17 points and Abuja got 18 points. Abuja was leading with 1 point. Then in section 3, Kano got 35 points, while Abuja got 24 points. So Kano was leading with 11 points. And the last section, Kano got 20 points and Abuja got 11 points. Kano is leading with 9 points. So if we are to total all the scores, you have 13 plus 17 for Kano, plus 35 plus 20. Then for Abuja, you have 15, 18, 24, and 11. Hope you are all following the calculation before you shout PDP here. So we have Kano scored 13 plus 17 plus 35 plus 20. They got 85 points. While Abuja got 15 plus 18 plus 24 plus 11. They scored 68 points. So we have Kano Group emerging the winner with 17 points ahead of Kano Group. Although you can see Kano Group was left alone. Her partner abandoned her that his network is not going through. But I know after the quiz, the network will resume. So congratulations to Kano Group and the
Thank you.
And I'll also congratulate the Abuja Group since she did it alone. It's a very interesting challenge and combat, even though we thought the Abuja Group initially developed cold feet, but later they now surfaced after we challenged them. Okay, so congratulations to everyone. You have another quiz next week. So I will choose some other volunteers as well as we'll start on time. So I'm going to share the quiz to your page so that you use it for your group discussions. So thank you very much for participating and have a good night rest. And tomorrow morning, you have your mock as usual. Thank you all. Tomorrow morning by 8:30 a.m., you have your mock. Thank you all.